Bring this leg up, bottom leg straight. I'm going to get you to scoot your hip forward, please. Thank you. Awesome. And good. Awesome. So you're in the right position. Pardon?
Feel that tension, that's for sure.
Already feels tight to you, huh? Yeah. Take a breath in. And all the way out, all the way out. Good, good, good. That was a big one. Yeah.
Good.
That tension, gone. All right, so I'm just coming in. You're already in the right position. That's convenient. Is it going to get you to take a big breath in and a big breath all the way out? Hi, Jose.
Hey.
Good to meet you.
Thank you.
Jose is a new patient brought in by a friend of mine today. He's been dealing with some pain in his lower back as well as both of his knees. I'm going to let him talk about his condition today, and then hopefully we're going to be able to help him out later. So, Jose, why don't you go ahead and tell us what's going on?
Well, I like I kind of mentioned, I've been playing like sports and mainly soccer since I was like 3.
Mm-hmm.
And I think the older you get, I mean, I'm only 25 now, but like I think once I kind of start getting to like my early 20s, I kind of start to realize, like things don't heal the same way, or like you know, you get injured in your ankle and then it's like it's still bruised for like the next month, and like that's not right. But I think the more sports I've been playing, like with biking and everything else I like to do, I think my body just starts to kind of maybe deteriorate a little bit more and a little more easy. I don't take care of myself as much as I would have when I was like 16. But the knee thing was more recent. I don't know how or why. I think maybe I just stopped being a little as active as I was, maybe. Like I used to bike more than I did, but the pandemic kind of stopped that and stuff. So there's definitely pain when I get up from like my knees being bent for like a while, even for like a little bit. They just gotta get very very sore and very tense. My lower back, I remember there was like maybe like an injury when I was about like 14 or 15 where like I did hurt my lower back playing soccer. And I was like, I remember being out for like a good like couple of months, just like I couldn't really stand up straight. I tried everything I tried to stretch it out, tried everything, and nothing really worked. So that was something I think that just kind of carried over until like.
So you've just been kind of dealing with low back pain since you were 14, then?
Yeah,
wow,
like I feel like it was like not as severe, and it's still not severe. But sometimes something I'll do, like if it's like another game of soccer or like just something active that I do, maybe triggers like some pain again, and I'll have it for like a few hours again, and then it's just like there for a bit. So definitely something that I've just kind of had to just live with.
All right. Well, I'm sorry you've been dealing with that for so long.
Okay.
Regarding the knee, so let's talk about the knee pain for a second. First, you said that like when you sit down and stand up, you feel pain in the knees. Where in the knees are you feeling that?
It's just right in the back, which is
in
weird.
the back aspect. Okay,
I probably won't feel it like in this position, but it's like when I have like my legs crossed, or if I'm like stretching, and like when they're like there's a lot of pressure like this, basically.
And then when you straighten it out, you're feeling that pain in the back of the knee.
Yeah, like I'll feel like it's kind of like it's slow for me like to straighten out, and then it goes away like not instantly, but pretty quickly. Like it doesn't stick around for a bit or anything. But
and that's both sides. Or just both sides.
It's odd. Never experienced that. Like I said, that's like more like in the last couple of years.
That's a newer thing. Okay.
Yeah.
And now with the low back, you've been dealing with it for almost 10, 11 years now. What have you tried to do to resolve it? Like, have you seen a physiotherapist or a chiro or a massage?
I tried seeing somebody once when I was like 20 or 21, but it didn't work out due to a weird I was mentioning this to our friend, but basically it was like a weird like spiritual thing they tried to like they wrote me into, so I kind of got deterred away from like these like from like this type of because I don't know too much maybe about like what like you and like maybe other like physio people do. So I kind of was deterred, I think, from like seeing another person because of that one experience. Unfortunately,
no, you know what? Actually, that's a common story where somebody will go see any kind of healthcare practitioner, have a negative experience, and then they will kind of apply that blanket logic to every other person in that field. So thanks for stepping out of your comfort zone a little bit here. I promise I'm not going to try to convert you.
That's essentially what it felt like.
That's not going to... This is we're free of that on this channel in practice. So, so today we'll take a look at the knees. We'll take a look at the lower back. Anything kind of like the upper back, shoulder region, or...
I do have this weird thing I do when like if I'm like just sitting anywhere for a while or like just like kind of hunched over for a bit, as people do nowadays. I feel like whenever I get up to like kind of straighten myself out, I'll put like my hands against my back and I'll just crack it.
And you can even crack the whole thing yourself.
Yeah, and like I don't know if that's like a bad thing, but it doesn't feel very natural. You know?
Some people say you shouldn't be self-adjusting, and it does carry with it a little bit of an increased risk of injury as compared to having a chiro do it for you, because you are engaging all of the muscles yourself. So muscles are supposed to be shut off when you're trying to reach the joint structures.
Right.
But I'm not going to tell you to do it or not do it. If it feels good for you and you haven't injured yourself doing it, I think that you're fine to proceed.
Yeah.
But you know, there is a little bit of a risk with it. I don't think it's as dramatic as some people make it out to be.
Cool.
Okay, so that's upper back. Anything shoulders or no?
Sometimes just tension or
Just
like
tension.
just some sore there. If I'm not careful, like if I overstretch it, but otherwise it's never been a big issue. But definitely from just I think all the stuff I do in my life,
Fair
there's
enough.
definitely tension there.
All right, so we'll screen from shoulders downward then. What we're gonna do? We're gonna be doing a physical, then we're gonna get into the treatments. Do you have any questions about either of those things before we get started? Or?
No, I'm pretty eager. I think.
Awesome.
So
Happy
I
to
think
hear
that's
that.
a good thing.
We'll get in. So Jose was mentioning that he gets his low back pain primarily brought on following moderate to vigorous activity or something endurance-wise.
Yeah.
So I am going to proceed with a full physical exam of his lumbar spine, but it might be difficult to provoke the pain or the chief complaint if exertion is the thing that's his primary trigger point. Anytime we're dealing with a case of exertion-based pain, it usually falls to a muscular endurance-based aspect. So with that, we're probably going to need to be looking at a core endurance-based routine, which I'll describe to him later, and you guys probably later in the later in the video as well. Been a long morning, guys. All right, I'm gonna bring this up as high as I can go. Any pain in the back with this?
Nope.
No.
Yeah.
Okay. Tightness in the hamstring, because I'm noticing you're having difficulty keeping the knee straight with this.
Oh,
there we go.
Sorry.
Look at that.
That's better.
That's better. Anything in the back?
Oh, definitely the hamstring. Yeah,
Hamstring,
like I'm feeling
okay.
the stretch.
Limited by the hamstring tightness. Okay. And we're gonna bring this up too. High as it'll go. And limited by the hamstring tightness, or anything in the back.
Nothing in the back, yeah.
But just tightness
the
there.
Hamstring, yeah. Feels
Okay.
nice though.
Feels good. All right, so Jose was also mentioning that he gets most of his knee pain when he's been sitting with a very, very bent knee for a while, right? So our hamstrings are our primary knee flexor group. Interesting to see that they're quite tight as well. But when he does try to extend his knee after a prolonged period of flexion, he feels that pain, bam, in the hamstring. So to me, that's telling me we're also looking at a hamstring mobility issue. So he might need to stretch them out. Isn't it convenient that when I'm stretching out his hamstring, he says that it feels good? So I think we might actually be able to slam dunk these two. Thankfully, that's going to make that a little bit easier. But regardless, let's still proceed with the way that we normally do. Gonna bring this over, gonna put my hand behind your back, and any discomfort with that, or any back pain rather. No? You're good?
Okay.
And we're gonna bring this up, bring the leg over, and any back pain with that.
A little bit.
A little bit of discomfort,
Yeah,
where?
more like right here, like in
Kind of right at the base, huh?
Yeah,
Okay, so
that's something I used to like that was like the main effect, like the injury I kind of mentioned when I was like younger. It's like
Yeah.
that's essentially where it came. Like it was right at the base where I felt hurt.
Yeah.
I kept trying to like stretch out like this, and like it just nothing would really go away.
Got it.
Yeah.
So he's pointing to his SI joint. All right, there you go, channel. Okay, next up, I'm going to get you. Actually, we'll do a hip screen as well. I'm gonna bring this up and around. Any knee pain or back pain as I'm doing this?
Knee, kind of.
Knee pain a little bit.
Yeah.
When? During this circle.
Like there.
Up at the top the most. Right? Basically, when you're most flexed, like you were
Yes.
saying beforehand. Okay. Let's do the same on the other side. Hit knee.
Ish. Not as much
Ish,
as
not as much. Okay. All right. Next up, I'm going to get you on your front. My hands are coming in on your back now, okay?
Thank you. Yes.
You're welcome. No problem. Happy to help. So Jose's got a little bit of tightness up in his traps, but it's nowhere near the worst that I've felt, so pretty standard. Little incidental cavitation. Okay. So I believe that when I was doing that pushed through your femur that you were feeling most of your discomfort. Was it here?
Yeah.
Yeah, so right again on that SI joint, that sacroiliac joint, guys and girls. How's that when I press here and pull here? What do you feel? Anything, or is that okay? Or
So far, okay.
So Jose feels quite actually tight on both SI joints, but it does feel even more locked on the right as compared to the left, but the left isn't pretty either. But that tells me that we're probably going to need to be working through mobility in this region here, but then also look to increase endurance with the core to try to be able to carry him through these full-length soccer or sports games or whatever it is that you are doing.
That's exactly it.
Isn't it?
I remember that injury so vividly.
So what actually happened? Like some kid kicked you?
No, I think I overdid it. I think it just in a kicking thing probably. I think I just overextended my leg, and then it was immediate. Oh, I can't run anymore. I couldn't sit up straight. It was,
shoot, man.
Yeah.
I thought it was another kid hit you. I was gonna say, I hope you at least hit them back.
No,
but
I would.
You got to get even in that case. If you're gonna feel this for 12 years, they got to feel it for 12 years too. You know.
No, I mean it was just I think my own doing. Just kind of I think I don't know what I did. But
I'm also joking. I don't advocate for hitting children. That's. I got to put that down there so I don't get demonetized. Okay. All right. So palpated in through here. You're quite tight up in through this region too. Not the worst I felt, but if you're comfortable with it, we're going to go ahead and adjust in through here, and then we'll get into your lower back in a minute, okay?
All right.
All right, so you've never been adjusted before, have you?
Nope.
So we kind of already got one incidentally up here. It was that little pop, but it's a little bit of a different mechanism. So what I'm going to do is, the first thing I'm going to do is actually bring this microphone over here, because that's why people click on Chiro videos. And going to get you to take a big breath in and all the way out. Very good. How was that?
It was cool, I think.
He thinks it was cool. Huh.
I heard a crack, that's for sure.
That is for certain. We're going to try again a little bit lower. Breath in. All the way out. There was a small one there, but that one was more subtle.
Yeah.
Okay, let's look into getting into the low back. And you're already in the right position. That's convenient. And what I'm going to do is I'm going to get you to take a big breath in and a big breath all the way out. You okay?
Yeah.
Good. I'll get you laying on your other side now, please. Swing this leg up, bottom leg straight. I'm going to get you to scoot your hip towards me, please. Thank you. Awesome. And good. Oh yeah, this is Jose, right SI, by the way. So, awesome. So you're in the right position. Pardon?
I feel that tension, that's for sure.
Already feels tight to you, huh? Yeah. Doesn't surprise me, but that's okay. Take a breath in. And all the way out, all the way out. Good, good, good. That was a big one. Yeah.
Really?
That tension, gone. All right. So, Jose, usually when I am doing this with patients, I will ask them a question so the audience can get to know them a little bit better.
Okay.
And that question, it's one of two. I'll ask you something about yourself for which you're proud of, but don't get to share very often because you feel like you'd be bragging. So, what do you got?
Well, I'm an aspiring actor.
Okay.
So I feel like that in and of itself for me is something I've been able to, I think, develop more pride in. The older I get and the more I do it, because I think as a kid I was very shy and I was very reserved and kind of stuck to myself. But I was always still truly who I was, just kind of on my own. But being older now and having done as much as I've done and been lucky to do, I feel like it's something to be proud of in the sense where I've just grown into, I think, the not yet. I think I'm still growing, but I think I've become a person that I think younger me would be proud of, and to look back and to have, it's like that cliche where like I think if I talk to my younger self, I would be able to tell him, hey, like it's gonna be mostly okay. There's gonna be some bumps in the road, but to look at it now, to have the talent that I do, the passion that I do for acting, and the patience that I think I have for acting too is something that I've become proud of, and I'm fortunate enough that I get to do it more often than not. So.
Well, good, man. That was a nice answer. Like, I hope we can all kind of look back and be at least semi-proud of the things and decisions we've made, right? Like,
yeah.
I know I feel the same way when I was friggin' how old? When I was 18, I guess. Like, I had no idea what the hell I was going to do with my life, and now I own a little healthcare practice. So I completely get where you're coming from, and that was honestly, that was a touching answer. Yeah.
Thanks.
No, thank you. All right.
What's happening now? 'Cause I can't see.
That's okay. So what I am doing is I am using these tools that I showed you earlier
Right.
to try to scrape out the musculature that we know is either painful, such as in the upper back, or is just very tight or hypertonic and not able to stretch in the way that it should, including the hamstrings.
Okay.
One thing I will say now for like the next 10 minutes,
Uh-huh.
let's just be quiet because this is like the quote-unquote ASMR component, because some people will just click videos for the sound.
Okay.
So yeah.
I can do that.
I only use them seriously.
Well, you're supposed to.
Relax, tender, eh?
Ticklish.
Oh, okay? If I go harder, is that better? Oh, that's worse. Awesome.
Sorry.
No, you have nothing to be sorry for, man. Trust me, the next thing we do won't be very ticklish.
I was saying, there's a spot on like my thigh right here that's very tender. When you were doing it with like the tools earlier,
Yeah.
I felt like it just hurt almost.
It was a tender spot, eh?
Yeah, like I've always felt like it's hard. Like this part of my muscle's like a lot harder almost.
Relax for a second. Good. So is it here or is it further that way?
I can't feel it now, but when you were doing like here almost, yeah, right there. Oh, right there.
Right there. Okay,
Yeah.
That's all hamstring again. Okay, I'll get you to just push your arm forward. Yeah. That's a cute little handhold moment, though.
You get it on camera?
Yeah, we did.
Oh, perfect.
There you go, internet. Yeah. So Jose is pointing right again to his hamstring group. I firmly believe if we're able to restore some mobility in here, we're going to see a decrease of all of his knee-related symptoms. So let's get him on his back, and we'll do the last thing that we're going to do for today. All right, so Jose, last thing we're going to be doing today is a little something called PNF stretching, or proprioceptive neuromuscular facilitation. Long-ass acronym, not important how to pronounce it. What is important is what it does. So the idea behind this is that by activating a muscle and then relaxing it, we are then able to further stretch out the reciprocative muscle. So when I say that, let me show this to you. I'll get you to bring this up as high as you can, and then in this position with the straight knee, I'm going to get you to drive this leg down into me as hard as you can, okay? Go right ahead. 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Relax. And after that relaxing, we're now able to move further, okay? Because he engaged the hamstrings and then relaxes them, we're now able to stretch the hamstring out further. So from this position, drive again. 10 seconds, as hard as you can. Holy crap, you're strong. No, don't apologize. 7, 6, 5, 4, 3, and 2, and 1. Relax. Good. So remember, we started like down here. This was maybe like 40-degree territory. Go ahead, drive. 10, 9, holy crap, 8, 7, 6. This is core stabilization for me. 5, 4, 3, and 2, and 1, and relax. Good, and I'm going to hold you right here, okay? So we were able to get up to almost 90 degrees. I'd say this is a solid 85, where he was nowhere near that before. Foot going numb a little bit, or are you okay?
Not that much.
Good, perfect. So that's why I love doing PNF stretching specifically, because the before and after effects are quite dramatic.
Cool.
This is something that he will need to do himself. It's possible to replicate this with a resistance band wrapped around your ankle, or having a friend or a partner or someone provide the body aspect, but very, very effective, as you can see right there. Now we're going to lower this down. We're going to do the same thing on the other side. There's my goal. I'm going to lift this up as high as it'll go. So we're at, what is that, 40 degrees, 45 degrees maybe? So go ahead, drive as hard as you can. 10, 9, 8, 7, 6, 5, 4, 3, and 2, and 1. Relax. Good. And drive. 10, 9, 6, 5, 4, 3, and 2, and 1. Good. And last one, go ahead. 9, 8. Yep, you can hold that if you need to. 7, 6, 5, 4, 3, and 2, and 1. Relax. Good. So this side feels like it's a little tighter, but we're able to get to about 85 again. Not quite 90, but a lot of improvement after just doing 3 or 4 of those. Okay, so good stuff. We can call it there. Thanks for coming in today. How did you find all of that?
It was kind of fun, I guess, to be honest. It was kind of cool to almost like even myself kind of get to know my body a bit more in that way. Like it's kind of nice to have someone like kind of tell you what's kind of going on, and then that way I get to feel more comfortable with it. So it was awesome. I really liked the PNF thing at the end. I think that was really fun. That was like just a really easy thing that anyone can do, and I thought that was awesome. It was really cool.
Yeah, no, PNF stretching is one of the, as Jose said, cooler things that we can do here. Again, anytime you engage a muscle and then relax it, that muscle is then going to immediately be more pliable. You can take advantage of that to increase your range of motion of pretty much any muscle that you like. So in this case, the hamstrings are a very common culprit of knee pain as he's experiencing right now. So I'd recommend to Jose and anybody else who's getting pain in the back of the knees that's really a result of being too flexed for too long to consider incorporating that into your rehab routine. Additionally, I did mention earlier about needing to build up some core endurance strength so that we can carry through these long sports games without getting that aggravation going on. I have made a video about core strength in the past. One of the first videos I actually made, you can check it out up there in the corner, and that'll list some more details about how to go about doing that. Otherwise, Jose, any other questions, comments, or concerns from me from today? Or
can't think of anything. I thought, I thought it was good. Anything that you can pinpoint from your perspective otherwise?
I would just say, I think your 2 conditions here are pretty simple when you know what to look for, right? And that's why, again, this is something that he's been dealing with for years and years and years. If you do have a problem that's been going on for this long, get it assessed by somebody who doesn't try to convert you, okay? Get it assessed by somebody who you trust and is knowledgeable in the field, whether that's a chiropractor, a physiotherapist, an osteopath, your MD, if your MD has a background in kinesiology and orthopedics and whatnot. Don't just live with it. There's a solution out there, okay? Otherwise, thanks for coming in, Jose. We'll end on I do high fives.
There you go. Thank you.
Watch this handshake stuff.
Don't forget to like, comment, and subscribe.
Thank you, Jose. Last thing we're going to be doing today, Jose, is a little something called PNF stretching, or appropriate. What's it called again? God damn it! It's such a long ass name. Proprioceptive neuromuscular facilitation. Okay.
For sure. So.